I'm Dr. Lisa Crosby. I'm a nurse practitioner from Cincinnati Children's Hospital. And I was wanting to talk to you today about asthma. A lot of times kids will ask me, well, what exactly is asthma? And can I catch it? Asthma is a condition that makes your airways, so inside of your lungs you have airways, kind of like a straw, that are open. That's the goal. But when you have asthma, they become inflamed. They become swollen. Mucus gets inside of them, and then they kind of collapse and you can't get air into them. And so that's the condition that asthma is. It makes it then very difficult to breathe if you can't get air in, because like a flat straw, nothing moves through it. So it's a condition, and it lasts a variable amount of time over one's lifespan, and there's different things that can make it act up or have problems. It is not contagious, so you cannot catch asthma from somebody who has asthma. So don't worry, you can't catch it. Now, it does tend to run in families. It's what we call genetic. So oftentimes, many people in a family may have it, but it's not because they caught it from each other. Some other common questions that I'm often asked, especially this time of year, is about the summer and asthma. So, is summer going to make my asthma worse? Summer itself doesn't make your asthma worse. What typically happens is because of the hot and humid weather that we have in the summer, that's what makes breathing more difficult for everybody, and oftentimes for those who have asthma as well. So because the air quality is poor, the humidity level is high, oftentimes with that we often have high levels of other allergens like mold or pollen that are in the air as well. Those are the things that make people's asthma worse, not summer season itself. But there are people who have asthma who sometimes don't have any problems at all in the summer. So it's not necessarily something that always goes hand in hand. Other questions people ask, especially in the summertime, is should I let my child go outside and play? And or for some of my older patients or kids, they'll ask about, if I'm an athlete, should I play sports because of my asthma? We want everybody to do everything that they want to do, even though they have asthma. So someone who has asthma should be able to do the same things that any other kid or adolescent or adult does that doesn't have asthma. If you're not able to do that, then what we want you to do is connect with your primary care provider so that they can help you better control your asthma. There are medications that can be taken to work on those airways, so it decreases that swelling so that that straw can open back up, because that's what we want. And medicines can help make that happen, along with some other things that may trigger your asthma. So sometimes then people ask for summer, is it okay if I swim if I have asthma? Again, yes, we want you to do everything that anybody else is doing who doesn't have asthma. Again, because there's allergens outside and allergens in our air, those things could make your asthma worse and make you have asthma symptoms like coughing or wheezing, having a hard time breathing, or maybe feeling like your chest is really tight. Not again necessarily because of the swimming alone. It could be because of the air that's outside. Some people, the smells that they smell when they're outside, those things bother their asthma. Sometimes the smell of chlorine could bother someone's asthma, just like sometimes bleach bothers people's asthma. But that doesn't mean that you shouldn't swim. It's really about knowing what types of things may cause problems for your asthma. Another question for summertime is fans and asthma. Should I never use a fan if I have asthma? It is okay to use a fan. The concern is that the air that blows around by the fan, again, probably has allergens in it that could aggravate your asthma. So if there's pollen or mold or dust, those are things that often cause breathing problems for people with asthma. So we just want to make sure the room, the fan itself, and the environment are as clean as possible if we're using a fan. Lastly, because of our current times, I want to address the issue of asthma and having or wearing a mask. It is very, very important that everybody should wear a mask. We all have a difficult time learning to breathe in a mask because it's something we've not done before for most of our lives. But it is very important, and it should not be any more difficult for a person with asthma, whose asthma is well controlled, to wear a mask than it is for anyone else. It's something that we all have to learn to do. We might start doing it a little bit at a time every day so that we can learn what that means, but it will not, nor should it, make your asthma worse. Again, if you have any concerns about your asthma, any concerns about not being able to doing the things that your friends are doing, or for parents, if your kids aren't able to do things other kids are able to do because of their asthma, please follow up with their primary care provider, because we want people with asthma to have wonderful lives and do all the normal things that everybody else does. Thank you so much.